How can your MRIs, X-rays, CT scans, and other studies help your disability application? And why am I always admonishing people to not talk about their MRIs during their disability exam? I'm going to explain these issues and others today when I talk about disability and imaging studies. Hello, my name's John Foster, and I'm a medical doctor who does Social Security disability exams. I've done over 1,500, and everything in this video reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now first, I need to talk a little bit about what are imaging studies. Doctors refer to imaging studies as those techniques that allow us to look under the skin to the inside of a patient's body. The first imaging study to be invented was X-rays. Another thing that's important to know is that most imaging studies rely on the difference of density or hardness of tissues. Doctors talk about soft tissues and hard tissues. Hard tissues are bone and metal, such as, for example, an artificial hip joint in a patient's body or a bullet in a patient who's been shot. Soft tissues are organs like the brain, heart, stomach, kidney, muscles, tendons, and cartilages. So first, let's talk about X-rays. X-rays are best for looking at bones and somewhat helpful for looking at the structures in the stomach and the chest. Sometimes doctors give a patient what's called contrast dye, which is a dye that makes things that are normally invisible on X-rays visible. This is often used to study the heart and blood vessels and the kidney and the urinary tract and the throat, stomach, and digestive tract. X-rays are very useful for showing arthritis and are probably the best imaging study for arthritis of the hips and knees. A CT scan is basically a fancy X-ray. A whole bunch of X-rays are done very rapidly, and then a computer reassembles the X-rays to show a more detailed picture of the person's organs. They're very useful for complicated bone problems, such as complicated fractures. They're also very useful for problems with the brain, and in some cases useful for problems with the lungs, heart, kidneys, and abdominal organs. When the CT scan was first invented, it was first used for the brain, and it's very useful in certain situations, such as bleeding inside the head or brain, such as may be caused by a bad hit to the head. Next, ultrasound. Ultrasound is images taken by use of very high frequency sound, so high that the human ear can't detect it. Ultrasound is good for solid organs. It's not helpful for bone, and if there's any air, it's almost impossible to get a good ultrasound. So, for example, ultrasounds are of no use for the lungs or the stomach, which both contain a lot of air. Ultrasound is what doctors use to take pictures of the baby in the womb, and it can be very helpful for taking pictures of the heart and kidneys, liver, and other solid organs. Also, ultrasound can be taken as a video instead of a snapshot. So one of the uses for ultrasound is to see how blood flows through the blood vessels and through the heart. That's helpful for seeing if there's a blockage in a blood vessel, for example, or if a heart valve is opening and closing normally. Just to make things complicated, doctors use 3 different terms for ultrasounds depending on what's being looked at. For the liver and the kidneys, we talk about an ultrasound of the liver and the kidneys. For studies of the heart, we talk about an echocardiogram. An echocardiogram is simply an ultrasound of the heart. And for studies of the blood vessels, we talk about a Doppler. For example, the study of the carotid artery in the neck to see if it's blocked or not is called a carotid Doppler. Again, it's simply an ultrasound of the carotid artery. An MRI is a scan that uses how atoms in a patient's body respond to strong magnetic fields. And it's best used for soft tissue. And it will work through air, unlike ultrasound. A CT scan will also work through air. MRI is best for visualizing soft tissue. In the bones and joints, it's good for looking at the cartilage, the lining of the bones, and for tendons, which are the cartilage tissue that attaches muscle to bone, and ligaments, which are the cartilages that join 2 bones together. It's not very helpful for looking at the actual bones themselves. In the spine, the MRI shows the vertebral discs very well. The discs are mostly made of cartilage. However, it doesn't show the bones very well. X-rays or CT scans are better for looking at the bones. Finally, there are a group of imaging called nuclear medicine scans. In this case, a patient is given a very small dose of radioactivity attached to a molecule that the human body uses. And then we see, where does that radioactivity go or not go? Does it go to where it should or not? Does it go to where it shouldn't or not? I've never seen a disability case where a nuclear medicine scan was helpful, so I won't discuss them further. So, how can your X-rays, scans, and ultrasounds help your disability application? Well, the first thing to understand is that Social Security considers all imaging studies as supporting evidence. They can help prove what's wrong, but they can't establish by themselves what's wrong. You need other evidence. They are not the best test for almost any medical condition. I know patients believe that these imaging studies are magic and tell the doctor everything about the patient's problems, but they really don't. By far, the best test is a careful history where the patient describes accurately and in detail what they experience and what's wrong, and a careful examination where the doctor looks at the patient very carefully. Those are far more helpful than any imaging study invented more than 90% of the time. And the absolute best imaging for structures inside the body is surgery. When a doctor cuts the patient open, they can see and feel and smell whatever tissue they're interested in. If something's in the way, they can move it out of the way for a better look. None of that can be done with imaging studies. And just a word of warning about the current fad for laparoscopic and robotic surgery. With the laparoscope or a robot, the doctor can't feel or smell what's going on, and that can be a big disadvantage. For example, when a doctor's operating in a patient's abdomen for any reason, they feel around and feel if there's any abnormal structures. The gallbladder feels like a little water balloon. And if there's gallstones, it's easy to feel. It feels like gravel in a water balloon. This takes the surgeon 10 seconds and is the fastest way to diagnose gallstones there is, and is 100% accurate. So having said all that, what if you do have imaging studies as supportive evidence for your disability? Well, the most important thing is to make sure that all your relevant imaging studies are sent in to Social Security. For example, if you have low back pain and you've had x-rays and an MRI, make sure that Social Security has them. And Social Security prefers recent studies, generally within the last year. If you're in the process of a disability application, sometimes people get additional studies. For example, they'll have already sent in their application and then they get another MRI. Well, be sure to send in the new studies. You can keep sending in studies until your final disability determination has been made by Social Security. Social Security may order x-rays of the relevant areas of your body, and Social Security pays for those x-rays. There's no charge to you. X-rays are the only imaging study they will order. They will not order MRIs, CT scans, or ultrasounds. So why am I so negative about patients talking about their MRIs at their consultative examination? Well, because there's a lot of confusing or lacking information in your MRI. First of all, many patients have abnormal MRIs but have no problems at all with the body part that's been imaged. For example, thousands of patients have abnormal discs in the MRIs of the spine of their low back, but have absolutely no issues whatsoever with their back. Now, your MRI cannot tell any doctor if you have pain in your neck or your back. You need to tell the doctor that. Your MRI cannot tell any doctor if you have limitation of range of motion with your neck, back, or any other joint. You need to tell the doctor that, and the doctor needs to see it on your physical exam. An MRI cannot give any information as to whether your strength is diminished or you have trouble with heavy lifting. You need to tell the doctor that, and the doctor needs to see evidence on your physical exam. Another thing most people are unaware of is that people can have neck or back pain or other joint pain, even severe pain, and have a completely normal MRI. In 2020, I got severe left shoulder pain if I tried to twist my arm behind my back. I saw a very good orthopedic surgeon. He took x-rays. I had an MRI. There were a few minor changes associated with aging, but none of those imaging studies showed what was wrong with my shoulder. And let me tell you, the pain was pretty severe. Now, the final reason to not talk about your MRIs or other studies at your consultative exam is because Social Security should already have them and have reviewed them. And the doctor who does your consultative exam should have already reviewed them. They already know what your MRI shows, and they want to get additional information that they cannot get from your MRI. Also, don't bring your CDs or written reports to the consultative examination. The doctor doing a consultative examination only talks with the patient and examines the patient. Doctors do not review records or images at a consultative examination. So instead of describing your MRI or x-rays or other studies, what you want to do at your disability exam is describe in detail the problems that you have and how those problems affect your ability to work. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.